Hello everyone, I'm Taha. I'm a fourth year medical student, and in this video we're going to go over the pathophysiology of appendicitis. So this is the first part of the appendicitis series. In future videos we're going to have a look at the clinical presentation, we're going to have a look at the investigation, and as well as the management options for patients with appendicitis. But today we're going to do the pathophysiology. So let's just jump straight into the video. So as always, we're going to bring back our beloved patient just to make this process a little easier and just bring some life into the video. So our patient, his name is Mr. Whitecoat, and Mr. Whitecoat has appendicitis. So let's have a look at what's going on within Mr. Whitecoat's stomach, and so we can understand what the pathophysiology of appendicitis actually is. Let's have a look at the word itself, okay? So, appendicitis, okay? So, the first part of the word obviously just referring to the appendix, right, within the body, and itis just means inflammation. So, this is a inflammation of the appendix, okay? Now, let's have a look at the pathophysiology, and to understand the pathophysiology of appendicitis, we'll have a look at the basic structure and the function of what the appendix actually is. So the appendix itself is a small sort of finger-shaped pouch that comes off the start of the large bowel, okay? So we have the large bowel here, and here is our appendix, okay? Obviously we'll have our small bowel, all right, that leads into the large, okay, and into the cecum, which is the first part of the large bowel. Now here is the appendix, okay. Now the actual function of the appendix itself is a little uncertain, but what we do know is that it plays a role in the immune response, okay, within the body. So there is lymphoid cells and immune cells within the actual appendix, and that has a role in the immune response, and it also produces mucus, right, and this mucus helps, you know, lubricate the lining of the bowel, okay. So those are there's a couple more functions that actually exist, and some of them we're a little unsure about, but let's just have a look at the pathophysiology now, okay. So the pathophysiology, the main thing, right, the first initial sort of driving factor of appendicitis is something we called luminal obstruction, okay. Now luminal obstruction obviously just means obstruction of the lumen, right, of the appendix itself. Lumen is just the hollow sort of channel that exists in tube-like structures within the body. So obviously in this case we are referring to the bowels. We can also use lumen for, you know, blood vessels and airways within the lungs itself. So this is a luminal obstruction, right, that actually causes, or this trigger essentially of appendicitis. Now, or the main trigger, I should say. Now, let's have a look at what actually causes, you know, that sort of obstruction. So the very first thing is fecaliths, okay? Now, what actually are fecaliths? Fecaliths are essentially small parts of hardened feces. Obviously, as you can imagine, there is feces floating around in the bodies of every human, or should be at least. And sometimes, if the patient has has a diet that is quite low in fiber, or they might be dehydrated, the feces can actually harden over time. And if this hardening, if a small part of this hardened feces lodges into the lumen of the appendix here, then that can be a trigger to the luminal obstruction. We'll have a look at why this obstruction actually leads to the appendicitis, but let's just focus on the causes of the obstruction first. So fecaliths, that's the first part. So hardened sort of feces, right? The second part is lymphoid hyperplasia. Okay. Now, what is lymphoid hyperplasia? Like we mentioned before, as part of the normal sort of function of the appendix itself, there is lymphoid tissue. So there is, within the submucosa of the appendix, there is lymphoid follicles. Okay. Now, lymphoid follicles are basically just clusters of immune cells, so B cells and T cells, and in response to any sort of infection, so a bacterial or a viral infection, these follicles can actually swell up, right? And as you can imagine, if they swell up within the appendix itself, then it will also lead to that narrowing and that obstruction, okay, of the lumen, right, of the appendix. The other thing could be things such as foreign bodies, right? Foreign bodies could be, just even bits of small bits of food. It could be things such as seeds that may get into the appendix and get lodged there, and obviously something a little more sinister such as cancer and tumors that can directly, impinge and obstruct the lumen of the appendix, can also cause that obstruction. Okay, so now we've had a look at what the causes of the luminal obstruction. Let's have a look at why this obstruction even causes, appendicitis. So you have the obstruction, okay, and we've looked at the causes. What happens next is there is an increase in the pressure, right, within the appendix itself. So this pressure, there's a couple things actually causing this rise of pressure within the appendix. We mentioned before that the appendix actually secretes mucus as part of its normal function, and if some sort of body or other things cause that luminal obstruction, the appendix doesn't actually know, that there is an obstruction. So it continues to perform its normal function, which is secreting mucus. And because this mucus has nowhere to go, normally it would go into the cecum, right, which is the part of the large bowel. But now it has nowhere to go. So it continues to build. Now, as it continues to build, it can actually expand and almost balloon the appendix, which increases that pressure within that space. And the second sort of thing would be direct inflammation. So as we know with inflammation, that when inflammation actually occurs, things like to swell, and the appendix would be no different. So let's have a look at why this increase in pressure is actually problematic. So when there is an increase in pressure, it exerts a pressure within the vessels, right, of the appendix wall. Okay, now namely it would be capillaries and veins. Okay, the veins being the main one here that we need to understand. So because veins are low pressure vessels, right, as opposed to arteries, any sort of not any sort of, but low pressure can cause the veins to collapse. Okay, so as the pressure within the appendix actually begins to rise, it can collapse the veins, right, that are draining the appendix. Bear in mind, there is still an arterial supply coming into the appendix, right? But now there is venous congestion because the collapsed veins within the appendix. Now, because there is venous congestion, it means that the circulation within the appendix has become compromised, right? So now when the circulation is compromised, what does it lead to? It means that oxygen, right, cannot get to the cells, okay? Even though there is still oxygen and still an arterial supply, it just means that the circulation is compromised because there's venous congestion and it's not circulating properly. Now, when that happens, it leads to hypoxia and, of course, ischemia. Okay. Now, when these occur, what actually happens? It leads to cell damage, right, and also cell death. Okay. Right. One other important point that we need to mention here is that when there is cellular damage, right, that obviously means that there is going to be inflammation, and also there is hypoxia. Okay, so now these two conditions where there is a stasis, so obviously because there is an obstruction to the outflow, right, within the appendix, now that means that things such as bacteria, they is a perfect place for them to grow, you know. So when there is hypoxia, it means that there is an anaerobic sort of environment, so anaerobic bacteria can now multiply and overgrow, and because they can't get flushed out, it means that they can continue to proliferate. Okay, now when that happens, there's bacterial overgrowth. Okay, and now when there's bacterial overgrowth, then there's obviously going to be an immune response to that overgrowth, and that means there is inflammation, right? So now we've kind of looked at the entire picture here. So we've started from the obstruction of the actual appendix, and we've understood why it's led to the appendicitis, meaning the inflammation of the actual appendix. Now, when the appendix is actually inflamed, it can lead to a couple of things if it's not treated promptly and adequately, right? So the main thing it can lead to is appendix perforation, right? And that's one we want to particularly avoid. Okay, it can also obviously lead to necrosis and gangrene if there is that cellular death occurring. But in terms of perforation, what actually happens is that all that bacterial overgrowth that's been going on inside the appendix, it's now able to freely flow into the peritoneal cavity. Now, when that happens, a few things can occur. So you can get peritonitis, which is obviously inflammation of the peritoneal cavity. It can also lead to abscess formations, right? And it can also lead to sepsis, which of course is a life-threatening condition that we want to avoid particularly. So that is a basic overview of the pathophysiology of appendicitis. So thanks so much for watching this video. In the next videos, we are going to go over the clinical presentation. So we'll have a look at the sort of signs and symptoms and the clinical presentation of what a typical patient actually looks like when they have appendicitis. So stay tuned for those videos, and thank you all so much for watching.